Hello, I'm Maruk Said, your microbiology guide. Let's explore in-depth micro techniques and uncover groundbreaking insight together on this educational journey into the fascinating realms of microbes.
Candida albicans explained. Table of contents. Introduction, habitat, morphology, cultural characteristics, life cycle, pathogenesis, virulence factors, lab diagnosis, treatments, prevention and control. Introduction to Candida albicans. Candida albicans is a common opportunistic fungal pathogen found in humans. It is a part of the normal microbiota of the mouth, gastrointestinal tract, and vagina. It usually lives harmlessly in the body under normal conditions. Overgrowth occurs when the immune system is weakened or normal flora is disturbed. It is a dimorphic fungus, meaning it can exist in both yeast and filamentous, hyphal forms. The ability to switch forms contributes to its pathogenicity. It reproduces mainly by budding in its yeast form. It can form biofilms on medical devices and tissues. It is one of the most common causes of fungal infections in humans. Infections caused by it are known as Candidiasis. It commonly causes oral thrush, vaginal infections, and systemic infections. Risk factors include antibiotic use, diabetes, immunosuppression, and poor hygiene. It can invade tissues and enter the bloodstream in severe cases. It is widely studied in microbiology due to its clinical importance.
If you have watched till here, don't forget to subscribe to Family of Science Lovers. Press the bell icon button so you are always updated.
Habitat of Candida albicans. Candida albicans is commonly found on mucosal membranes of humans and other warm-blooded animals. It naturally inhabits the oral cavity, gastrointestinal tract, and vagina. It can also be present on the surface of the skin. It exists as a normal commensal organism under healthy conditions. It is found in the digestive tract of birds as well. It can be isolated from environmental sources such as soil. It is also detected in animals and hospital environments. It may be present on inanimate objects and contaminated surfaces. It can occasionally be found in food sources. It has a worldwide distribution and is found globally. Morphology of Candida albicans. Candida albicans cells are small and oval in shape, measuring about 2 to 4 micrometers in diameter. It exists in a yeast form which is unicellular. It reproduces mainly by budding. Single budding of the cells is commonly observed. Both yeast cells and pseudohyphae appear gram-positive on staining. It is an encapsulated and diploid organism. It can also form true hyphae under certain conditions. It is a polymorphic fungus, showing yeast and pseudohyphal forms. It has the ability to form biofilms on surfaces. Under normal conditions, it exists primarily in the yeast form. Under special conditions, such as changes in pH and temperature, it forms pseudohyphae. Its cell wall is composed of about 80 to 90% carbohydrates. Cultural characteristics of Candida albicans. Sabouraud dextrose agar, SDA. Creamy, smooth, and pasty colonies are observed. Colonies develop within 24 to 48 hours. Growth occurs at 25 to 37 degrees Celsius. Colonies appear white to cream in color. Yeast-like characteristic odor is present. Blood agar. Colonies appear white to creamy in color. Smooth and slightly raised colonies are formed. Characteristic foot-like extensions may be seen from the margins. Growth is visible within 24 to 48 hours. Potato dextrose agar, PDA. Smooth and creamy colonies are formed. Colonies develop within 24 to 48 hours. Growth appears moist and glistening. Chromagar candida. Colonies appear green in color. Helps in differentiation from other Candida species. Colonies are smooth and well-defined, useful for rapid identification in clinical laboratories.
Download our microbiology study app made for researchers like you.
Life cycle of Candida albicans. It reproduces asexually and does not undergo true meiosis. It shows 3 distinct morphological forms: yeast, pseudohyphae, and true hyphae. It follows a parasexual life cycle instead of a typical sexual cycle. It has the ability to switch between different phenotypes. Efficient mating requires diploid cells of opposite mating types. These cells must switch from the white phase to the opaque phase before mating. After switching, cell fusion occurs between compatible cells. This fusion results in the formation of tetraploid cells. Tetraploid cells return to the diploid state through chromosome loss. This process occurs without meiosis and is called a parasexual cycle. White form consists of round, smooth cells forming dome-shaped colonies. Opaque form consists of elongated cells forming flatter colonies. Opaque form is more efficient for mating compared to the white form. Pathogenesis of Candida albicans. It is an opportunistic fungal pathogen that causes candidiasis in humans. It normally exists as a commensal but becomes pathogenic under favorable conditions. Infection commonly occurs in immunocompromised individuals. High-risk groups include HIV-infected patients, transplant recipients, and chemotherapy patients. It can overgrow when normal microbiota is disrupted, such as after antibiotic use. It adheres to host tissues and forms biofilms, enhancing its virulence. It can invade tissues by switching from yeast to hyphal form. It produces enzymes that help in tissue invasion and damage. Mode of transmission. It can be transmitted from mother to infant during childbirth. Sexual transmission is rare but possible. Person-to-person transmission may occur in hospital settings, especially via contaminated hands or surfaces. Virulence factors of Candida albicans. Polymorphism is a key virulence factor showing yeast, pseudohyphae, and hyphal forms. Hyphal form is more important for tissue invasion and infection. Adhesins such as ALS3 protein help in attachment to host surfaces. These are glycosylphosphatidylinositol, GPI, linked cell surface glycoproteins. They also play an important role in biofilm formation. Invisins like ALS3 protein promote invasion into epithelial and endothelial cells. SSA1 encodes a heat shock protein that induces host cells to engulf the fungus. Active penetration into host cells occurs through hyphal formation. Biofilm formation enhances survival and resistance. Sequence includes yeast adhesion to surface colonization to hyphal development to mature biofilm to dispersion of yeast cells. Transcription factors such as BCR1, TEC1, and EFG1 regulate biofilm formation. Secreted hydrolases include proteases, phospholipases, and lipases. These enzymes help in tissue invasion and nutrient acquisition. Include SAP1 to 10 proteases, multiple phospholipases, and LEP1 to 10 lipases. Metabolic adaptation allows survival in different host environments. It can switch between glycolysis and starvation responses. Activation of the glyoxylate cycle supports survival in nutrient-limited conditions. This adaptability allows spread to multiple organs via bloodstream. Stages of infection. Colonization involves epithelial adhesion and nutrient acquisition. Superficial infection includes epithelial penetration and host protein degradation. Deep-seated infection involves tissue penetration, vascular invasion, and immune evasion. Disseminated infection includes endothelial adhesion and spread to other organs. It may activate coagulation and blood clotting cascades. Types of candidiasis. Mucosal candidiasis. Oral candidiasis affects the mucous membranes of the mouth. Denture-related stomatitis causes inflammation under dentures. Angular cheilitis causes cracks at the corners of the mouth. Median rhomboid glossitis leads to loss of tongue papillae. Vulvovaginitis causes white lesions in vulva, vagina, and cervix. Balanitis affects the glans penis. Esophageal candidiasis causes painful swallowing. Cutaneous candidiasis. Candida folliculitis causes infection of hair follicles. Candidal intertrigo affects skin folds. Candidal paronychia involves nail fold inflammation. Perianal candidiasis affects skin around the anus. Chronic mucocutaneous candidiasis is linked to T-cell immune defects. Congenital cutaneous candidiasis occurs in newborns. Diaper candidiasis affects the diaper area in infants. Erosio interdigitalis, blastomycetica, affects skin between fingers. Candidal onychomycosis causes nail infection. Systemic candidiasis. Candidemia can lead to sepsis. Disseminated candidiasis affects multiple organs. Endocarditis involves infection of the heart lining. Gastrointestinal tract infection may occur. Respiratory tract infection can develop. Genitourinary candidiasis affects urinary and genital systems. Hepatosplenic candidiasis is a chronic disseminated infection affecting liver and spleen. Lab diagnosis of Candida albicans. Specimens. Clinical samples include exudates, tissues, and skin or mucosal scrapings. Microscopy, scrapings. Wet mount examination is done using 10% KOH preparation. Pseudohyphae and budding yeast cells are observed. Gram staining shows gram-positive, positive yeast cells. Culture. On Saborod dextrose, agar, SDA, creamy white smooth colonies are formed. On chromagar, characteristic green-colored colonies appear. Identification tests. Germ tube test is positive within 2 hours when incubated in human serum at 37 degrees Celsius. Chlamydospores are produced on cornmeal or rice agar at 25 degrees Celsius. These are round, thick-walled structures formed terminally or laterally. Biochemical tests. Glucose and maltose are fermented with acid and gas production. Sucrose and lactose are not fermented. Pale pink coloration appears in tetrazolium reduction medium. Serology has limited specificity due to widespread exposure. Serum antibodies and cell-mediated immunity are present in most individuals. Delayed hypersensitivity skin test indicates cell-mediated immunity, CMI. ELISA and RIA detect circulating Candida antigens such as mannan. 1,3-beta-D-glucan assay detects beta-D-glucan, a component of the fungal cell wall, works by activation of factor G in the horseshoe crab coagulation cascade. It is a highly sensitive and specific diagnostic test. Molecular methods. DNA probe techniques are used for detection. PCR provides rapid and accurate identification. Treatments of Candida albicans. Oral candidiasis, treated with antifungal agents such as nystatin. Topical azoles like miconazole are commonly used. Severe cases may require amphotericin B. Cutaneous candidiasis, treated with topical antifungals such as clotrimazole and iconazole. Other options include cyclopyrox, ketoconazole, miconazole, and nystatin. Systemic and oral azoles. Common drugs include fluconazole. Alternatives include itraconazole and posaconazole. Vulvovaginal candidiasis. Single-dose oral fluconazole is effective. Topical antifungals include butoconazole, clotrimazole, miconazole, nystatin, ticonazole, and turconazole. Bloodstream infections, treated with intravenous fluconazole. Echinocandins such as caspofungin are also used. Candidemia. Managed with fluconazole or anidula fungin. Early treatment is important to prevent systemic complications. Prevention and control of Candida albicans. Maintain a healthy lifestyle to support a strong immune system. Practice good hygiene and proper personal care. Ensure a balanced diet with proper nutrition. Use antibiotics carefully to avoid disrupting normal microbiota. Include probiotics in the diet to support beneficial microorganisms. Reduce sugar intake to limit fungal overgrowth. Wear cotton underwear and loose-fitting clothing. Change wet or damp clothes immediately to prevent fungal growth.
Thank you so much for watching. Don't forget to subscribe to my channel, press the bell icon button. Thank you!